Welcome back, everyone, to the 21st Century Man podcast. We're always excited to dive into these chapters, and today we're tackling a big one, chapter 22, reducing the risk of disability.
Yeah, this one is packed with really useful information.
Definitely. And you know what's cool about this one? This chapter was actually flagged by one of you listeners out there, so shout out to whoever sent that in. Clearly, this topic is resonating, and honestly, who doesn't want to stay active and mobile for as long as possible?
Absolutely. It's something we all think about, especially as we get a little older.
For sure. The book, The 21st Century Man, just does a phenomenal job of breaking down these complex health topics. I highly recommend grabbing a copy if you haven't already. But for now, let's unpack some of Dr. Lipman's wisdom on reducing our risk of disability. So where do we even begin with this?
Well, right off the bat, Dr. Lipman hits us with a pretty compelling story about Cesar Torres, former professional baseball player. He talks about how this seemingly minor hamstring pull he had, it ended up radiating pain to his back and leg to the point where he could barely do some of the fundamental movements in baseball.
Oof, that'd be tough, especially at that level. I mean, professional athletes, their bodies are their livelihood.
Exactly. And I think what this story so brilliantly illustrates is this idea that pain in one area can have like these cascading effects throughout your body. It's not always isolated.
Yeah, it's a good reminder to pay attention to even those little aches and pains. Don't just brush them off.
Absolutely. And that really leads into Dr. Lipman's central argument in this chapter. Disability, he argues, is often not the result of like one single catastrophic event,
Right.
but rather it's this gradual accumulation of smaller controllable factors.
Okay, I like that. It kind of puts the power back in our hands.
Right. Precisely. You're not just a victim of circumstance. There are things you can do every day to minimize your risk. So he goes on to outline some of these major causes of disability, things we can actually control.
Perfect. Let's dive into those. What's the first one on the list?
So he starts by talking about fatigue, deconditioning, and muscle atrophy. Essentially, what happens when we're not using our muscles enough. And one of the biggest culprits here, desk jobs.
The modern day dilemma. Tell me about it. I feel like I'm glued to my chair half the day.
Right. And Dr. Lipman doesn't mince words here. He straight up says sitting is the new smoking.
Whoa, okay. That's a pretty bold statement. I mean,
Yeah.
Is it really that bad?
Well, when you look at the stats, it's hard to argue. He points out that a sedentary lifestyle more than doubles your risk of heart attack and stroke. We're talking like a 147% increase.
Seriously.
And it almost doubles your risk of dying from a cardiovascular event.
Okay, those numbers are definitely sobering. So if I'm hearing you right, basically all that time we spend sitting is seriously upping our risk for some pretty major health problems. No more vegging out on the couch for me.
Yeah, it's a wake-up call for sure. And it's not just heart problems. Dr. Lipman talks about this thing called sitting disease. Have you heard of that?
I have, but I'm not sure I totally get it. What is sitting disease exactly?
Well, the core issues are twofold: weight gain and inflammation. Think about it. When you're inactive, you're just not burning as many calories. So the weight can creep up. Plus, inactivity messes with your circulation.
Okay, makes sense.
Your capillaries, those tiny blood vessels, they're not working as efficiently, so oxygen and nutrients aren't getting delivered as well as they should be. And that sluggish circulation contributes to low-grade inflammation throughout your body. It's like a slow burn that can lead to all sorts of problems over time.
So, to put it simply, sitting disease is this combo of getting heavier and your body being inflamed, all because you're not moving enough.
Exactly. And it's crazy because he gives this example, just to really drive it home, about how gaining like 40 pounds can increase the pressure on your knees by 20%. Just think about the impact that has on your joints over time.
Yikes.
Yeah.
And it's not just our knees, right? I mean, we're putting extra stress on all our joints.
Absolutely. Hips, ankles, even your spine, they're all taking a hit. And remember all that inflammation we talked about? Well, that just makes things worse. It's like a vicious cycle.
Yeah.
And you know what's even more concerning? Dr. Lipman points out that this pattern of excessive sitting often starts in childhood. Think about kids sitting at school desks for hours on end. It's like we're setting ourselves up for problems from a young age.
It's true. I remember those days. Okay, so we've got the sitting issue covered. What's next on the list of disability risk factors?
So he touches on repetitive motion injuries, especially those that happen in the workplace. Now, he doesn't dive super deep into it here in this chapter, but the point is that if you're doing the same movements over and over again...
Like typing all day.
Exactly. Or working on an assembly line, you're putting repeated strain on certain joints and tissues. And over time, that can lead to injuries.
Yeah, makes sense. It's like wear and tear on your body. So what's the takeaway here? Should we all quit our jobs and become yoga instructors? Just kidding, sort of.
Well, I wouldn't go that far, but seriously, it's about being aware of the repetitive motions in your job and seeing if there are ways to change things up, maybe make some ergonomic adjustments to your workspace to minimize that strain.
That's good advice.
Hmm.
Okay, now for a topic I know a lot of us can relate to. Weekend warrior syndrome. We're busy all week, then try to cram all our physical activity into the weekend. What's the problem with that approach?
Well, the danger is that you're going from 0 to 60 way too quickly. Your body's deconditioned from sitting all week, then bam, you hit it with this intense workout or activity, and it's just not prepared for that.
Yeah, I can see how that would lead to injuries.
Exactly. And you know what's interesting? He says most of these weekend warrior injuries are what he calls dis events.
Disc events. Can you break that down for us?
Sure. So you've got these intervertebral discs in your spine, right? They're like cushions between the bones.
Okay.
Well, when you put sudden excessive force on them, they can bulge or even herniate, and that can cause a lot of pain and even nerve problems.
Ouch. So what's the solution? Do we just have to accept that we're going to be couch potatoes all week?
Not at all.
Mm.
Dr. Lipman gives some great practical advice. First, regular exercise is key, even if it's just a little bit each day. It helps you stay conditioned so your body's better prepared for those weekend activities.
Right. Consistency is key. Right.
Exactly. He also says, be honest with yourself about your fitness level. If you're not used to high impact stuff, don't just jump into it. Ease in gradually.
Good point.
Mhm.
And when it comes to things like lifting heavy objects, it's okay to ask for help.
Absolutely. He actually uses this funny example of someone trying to move a 500-pound fire pit all by themselves, calling it idiotic.
Yeah.
But it really drives home the point that we need to use common sense.
Yeah. No need to be a hero. Ask for help. Use tools. Work smarter, not harder. Solid advice. Okay, what's the final risk factor Dr. Lipman talks about?
The last one is this idea of unconscious dysfunctional movement patterns.
That sounds a bit complicated. What exactly does that mean?
It's basically the way we move throughout our day without even realizing it, like your posture when you're standing or walking, how you bend over to pick something up, even how you sit at your desk.
Okay, I think I'm following.
So if these everyday movements are off, if they're putting strain on your joints and muscles, it can add up over time and lead to problems. It's like little by little, you're creating these imbalances in your body that can eventually manifest as pain or even disability.
So even if we're not feeling pain right now, the way we're moving could be setting us up for problems down the road.
Exactly. And this concept actually ties in really well with something he talks about later in the chapter about the importance of re-educating ourselves on how to move properly. But we'll get to that.
Sounds good. All right, let's shift gears a bit and talk about osteoarthritis. I feel like a lot of people, myself included, don't really understand what that is. Can you give us a quick rundown?
Sure. So Dr. Lipman explains that osteoarthritis is basically the wear and tear on your joints over time. It's that cumulative effect of years of use, maybe some old injuries thrown in there. And what's important to note is that it's different from, say, rheumatoid arthritis, which is an autoimmune condition.
Got it. So one's like mechanical wear and tear, and the other is more of an immune system issue.
Precisely. And with osteoarthritis, because it's primarily mechanical, there's a lot you can do to influence how it develops and progresses. You have more control, which is a good thing.
That's reassuring. But genetics play a role too, right? Like if your parents had osteoarthritis, you're more likely to get it.
That's true. He talks about how some people are genetically predisposed to inflammation, which can contribute to things like bone spurs and joint problems. And even if you're super healthy, eating right, taking supplements, you might still be more prone to it because of your genes.
Okay, so genetics can't be ignored, but is there anything we can do to counteract that predisposition?
That's where things like chiropractic care come in. Dr. Lipman stresses that good biomechanics, essentially making sure your body is moving efficiently, can really help minimize those genetic risks. And that goes hand in hand with making healthy lifestyle choices. So you're not doomed just because it runs in your family.
That's good to hear. So for those of us with a family history of osteoarthritis, what kind of specific things can we do to, protect ourselves?
Well, Dr. Lipman recommends being proactive, building in those protective measures into your routine. He suggests regular chiropractic adjustments to keep your spine aligned and moving well, consistent exercise, a good diet that's low in inflammatory foods, and limiting things like alcohol and sugar. All pretty straightforward things, but they can make a big difference in the long run.
Yeah. It's all about those healthy habits. All right, so let's say you've had some injuries in the past. Maybe you were an athlete or just had some accidents along the way. What advice does Dr. Lipman give for managing those old injuries and preventing them from becoming major issues later on?
He focuses a lot on movement quality. He talks about this idea of segmental movement in the spine, meaning that each section of your spine should be able to move freely and independently. And if it's not, that can lead to problems. So he recommends getting evaluated by a movement specialist, someone like a chiropractor or physical therapist, to identify any areas that are stuck or not moving properly. Then it's about relearning how to move in ways that minimize stress on those old injuries. And that often involves things like stretching, strengthening exercises, maybe even incorporating yoga or Pilates into your routine.
Yeah, I can see how that would make a difference. So it's not just about avoiding certain activities, it's about actively improving the way you move overall.
Exactly. And of course, managing those sitting habits we talked about earlier is crucial too. He introduces this really interesting concept called silent inflammation. Basically, it's this low-level inflammation that can be present in your body for years without you even realizing it. And over time, it can contribute to joint degeneration and other problems.
Silent inflammation, that sounds kind of sneaky.
It is. It's like this underlying process that's slowly chipping away at your health. But on the flip side, he also talks about how acute inflammation, like tendonitis or bursitis, can actually be an early warning sign of developing arthritis. Even if the pain isn't in the bone itself, that inflammation is a signal that something's not right.
Interesting. So inflammation can be both a silent threat and a potential early alarm.
Yeah, it's a bit of a double-edged sword. But the main point is that inflammation needs to be addressed, whether it's silent or causing you pain. And one of the ways to do that is by improving your ergonomics, making sure your workspace is set up in a way that supports your body so you're not constantly triggering that inflammation.
That makes a lot of sense. And speaking of things that can be misleading, the chapter also talks about how what you see on an MRI doesn't always correlate with how much pain you're in.
Yeah, that's a big one. He gives this example of how someone can have a really bad MRI showing lots of arthritis, but they're not in much pain at all. And then someone else can have a relatively clean MRI and be in agony. It really highlights that pain is complex.
Totally. I feel like so many people get hung up on what their imaging shows, but it's clearly not the whole story.
Right. He talks about this thing called referred pain, where the pain you're feeling in one area is actually coming from a problem somewhere else. Like you might have hip pain that's actually caused by a disc issue in your spine. So it's really important to get a thorough evaluation from a qualified practitioner to figure out what's actually going on.
So if we're experiencing pain, when do we know it's time to seek professional help? And speaking of that, let's talk about preventive care. What does Dr. Lipman recommend?
Well, he really positions chiropractors as the go-to experts for low back pain, especially for those mild to moderate cases. And he stresses the importance of early intervention. Catch it early, address it with conservative methods, and you're much less likely to end up needing more invasive treatments like medication or surgery down the line.
Okay, so if we're feeling those aches and pains, don't just ignore them. Go see a chiropractor.
Exactly. He actually provides this helpful decision tree for early intervention, starting with the most conservative options. Like, first, look at your ergonomics, your posture. Are you sitting properly? Is your workspace set up in a way that supports your body? Then maybe try some stretching, exercises, supplements. If those things aren't enough, you can consider personal training, over-the-counter pain relievers, then maybe see a chiropractor, physical therapist, or even an acupuncturist.
I like that step-by-step approach. Start with the basics, then gradually escalate if needed.
Exactly. And further up the tree are things like prescription medications, imaging, injections, and finally, surgery as a last resort. But the idea is to try those less invasive options first.
Makes sense.
Hmm.
He also talks about this idea of applying an ounce of prevention and how the level of care you need depends on whether the condition is acute, meaning it just started, or chronic, meaning it's been going on for a while.
Right. So for like a minor acute injury, you might just need a few visits to the chiropractor and some exercises, and you're good to go.
But for something that's been bothering you for months or even years.
Yeah, that might require a more comprehensive long-term approach. He also gives some really practical advice on how to find a good chiropractor.
Yeah, finding the right practitioner is crucial. What are some of his tips?
He says, check online reviews and don't be afraid to ask questions like, what does a typical visit look like? What kind of care plan can you expect? And definitely ask about costs up front to avoid any surprises or predatory practices.
That's all really good advice.
Yeah.
Now, what about imaging? A lot of people seem to think they need an X-ray or MRI right away if they have back pain.
Hmm.
What does Dr. Lipman say about that?
He's pretty clear that in his practice, he mainly uses imaging to figure out why someone might not be responding to treatment, not necessarily as the first step in diagnosis. So if you're not getting better with conservative care, then imaging can help pinpoint the problem.
So it's a tool to guide treatment, not a starting point for everyone.
Exactly. And he really emphasizes that chiropractic care should be science-based. So specific exercises, evidence-based techniques, and, if your acute injury is resolved, he believes in releasing patients from care. There's no need to keep people coming back unnecessarily.
I like that. It's about empowering people to manage their own health. Okay, last question. What if you do get injured? What role does Dr. Lipman see chiropractors playing in the recovery process?
He sees them as like the quarterbacks of the recovery team, especially in cases like workers' comp, where things can get a bit more complicated. So it's not just about adjusting the spine, it's about assessing those biomechanical issues, figuring out if physical therapy or ergotherapy are needed, and knowing when to refer to a pain management specialist or even for a surgical assessment. It's about having that comprehensive view and making sure the patient's getting the right care at the right time.
That makes a lot of sense. And speaking of surgery, there's this really striking statistic in the chapter. He says if you go see an orthopedist or spinal surgeon first, there's like a 50% chance you'll end up having surgery. But if you start with a chiropractor, physical therapist, or pain management specialist, that number drops to less than 10%. That's a huge difference.
It is. Now, he does acknowledge that if you're in severe pain, you might naturally gravitate towards a surgeon first. But those numbers really highlight the importance of exploring those more conservative options early on.
You give those non-invasive approaches a try first. He also talks about the tendency to just rely on pain medication. What are the potential pitfalls of that approach?
Well, pain meds can definitely provide temporary relief, but the problem is they can mask the underlying issue, especially for more complex injuries. So you might be feeling better, but the problem's still there, and it could be getting worse.
So you're just delaying the inevitable.
Exactly. He really advocates for seeing a manual therapist or movement specialist who can actually address the root cause of the problem, not just mask the symptoms. Someone who can work on those muscles, those joints, and teach you how to move better to facilitate healing.
So it's about treating the whole person, not just the pain.
Exactly. And he also touches on this idea of integrative medicine, which is basically using the best of both worlds. He acknowledges that there are times when surgery and medication are absolutely necessary, but we as a society tend to overuse them. And we often overlook those physical interventions like manipulation and exercise, which have been proven to be really effective for low back pain.
It's like we jump to the most extreme solutions when sometimes the simpler ones might work just as well.
Right. And he talks about this positive trend of direct access to chiropractors and physical therapists, which means you don't need a referral from your doctor to see them. You can just go directly. And he sees that as a really good thing because it gives people more autonomy over their health care and allows them to get that physical care without having to jump through hoops.
It's about empowering patients to take control of their health, which I'm all for. He also talks about the extensive training that chiropractors and physical therapists undergo.
Yeah, and I think it's important to highlight that because some people don't realize how much education and training these professionals have. Chiropractors actually complete a similar number of hours as medical doctors, although their focus is different. And both chiropractors and physical therapists typically do a 3-year doctorate program after their undergraduate studies.
Wow, so they're highly qualified.
Absolutely. They're trained to diagnose within their scope of practice. They can prescribe therapeutic exercise. They can perform manipulation. Chiropractors often take a more holistic approach, incorporating things like nutritional counseling. And often they can provide that care at a lower cost and with faster access than going through the traditional medical route.
That's great to know. And finally, he brings up this idea of periodic checkups with a chiropractor or PT, even if you're not currently having any problems.
Yeah, kind of like we do with our teeth. Regular dental checkups help prevent bigger problems down the road, and he sees that same logic applying to our musculoskeletal health. Now, it's not super common yet, but he believes those regular checkups can help catch those little issues before they become big ones.
Preventative care is always the best medicine. He also mentions the increasing collaboration between chiropractors and medical doctors, which I think is a really positive sign.
Definitely. It shows that the healthcare system is starting to recognize the value of those different approaches and working together to provide patients with the best possible care. And ultimately, I think the biggest takeaway from this chapter is that we need to take an active role in our own health, educate ourselves, listen to our bodies, and be proactive about taking care of ourselves.
Couldn't have said it better myself. Wow, that was a deep dive. So much great info in this chapter. Big thanks to Dr. Lipman for writing such a comprehensive and insightful book.
Absolutely. If you're enjoying this deep dive, I highly recommend checking out The 21st Century Man. It's packed with actionable advice on everything from nutrition and fitness to mental health and relationships. It's a real gem.
And a huge thank you to all of you for tuning in to the 21st Century Man podcast. We hope you found this discussion helpful and empowering. Don't forget to join us next time as we continue our exploration with Chapter 23, Spine Care. We can't wait to delve into that with you.